So I want to start by naming something that we all know, but we don't say out loud enough. And that's that sleep has become one of the most confusing topics in health. On one hand, it's treated like a lifestyle flex, right? We track it, we optimize it, we hack it. We wear three devices and we compare scores like it's a competition. And on the other hand, it's minimized. You're tired? Everyone's tired. You're not sleeping? That's just stress.
Melatonin is a chronobiotic. Okay, so this is one of the most important things to know about melatonin is that it's not a sleep aid. It's not a sedative. It is a body clock regulator. So I'm going to explain what that means.
When we talk about mental health in sports, we do know that in student athletes, when they are not getting enough sleep, it diminishes the ability to recognize positive emotional stimuli. So they're able to still recognize negative emotional stimuli, but not positive. So if a coach encourages them, they may not recognize that as encouragement, but if a coach criticizes them, they will certainly recognize that criticism.
And sleep deprivation actually can change the way you behave. And this kind of sits on this backdrop of the way you think and the way you feel. This translates into having more impulsive behavior. You tend to have a reward or gratification seeking stance. Substances become more prominent on a backdrop of sleep deprivation. And there's increased appetite, increased eating, and cravings typically for high carbohydrate, high fat, high salt foods, snack foods, as it were.
What happens when we start doing all of these sorts of activities in bed? Well, if we're pairing and doing these things, reading in bed, scrolling on our phone in bed, petting our pets and hanging out with our pets in bed, or worrying or planning in bed, over time, obviously unintentionally, what we're doing is we're making associations between the bed and these activities.
Now, a lot of technology that's able to at least assess for, sleep apnea, presence or absence of sleep apnea, but it has its technical and equipment limitations. It can underestimate the severity. Most of them don't assess EEG. So for children that have what we call arousal-based events, respiratory events, you might miss it, but it's an option in some practices. I use it in my practice because I have a lot of otherwise healthy children that, we just need to know, do they have sleep apnea or not?
Where I'm going to talk about sort of a holistic approach to sleep. And what do I do when I see patients in front of me who are like, Dr. Cacho, I've been struggling with sleep. I'm sleeping 2 hours at night. So honestly, I just sit and listen to them. And I say, well, do you have a hard time falling asleep? Do you have a hard time staying asleep? Or is it both? And what are your health goals? If I said, 1 month from now, if we could improve your sleep or just your health in general, what would that look like?